And there you go. We're back on Morning Barbados, and I was talking about the Formula One race, the German Grand Prix, and there was a spectacular crash. I think we've got a photograph of that, do we?
Okay.
Look at this. Look
Wow.
at this. And would you know?
Spectacular.
Spectacular is the word. And he walked away from that. Can you believe it?
Yeah, that happens a lot. I guess those vehicles are built for that to happen, or for that to be allowed. But thank goodness, because there have been some serious ones as well.
Yeah. He lived to talk about it.
He sure did. Well, that's good stuff. Good stuff. Good action.
Yep.
When things turn out well.
Speaking of action, we have a man of action joining us this morning, as usual on Monday. He's our dermatologist, Dr. Andrew Forde, and we're going to talk about a subject that we don't know enough about, but we hear it all the time, and perhaps this is a good time to shed some light on lupus. What is lupus? Good morning, first of all.
Yes.
Tell us what is lupus.
And all the viewers. Lupus is a chronic autoimmune inflammatory condition, which is very common in Barbados. And what happens is that the body's immune system attacks healthy tissue, and those tissues are vital organs in the body. Of course, the skin is one of these organs that is affected, but the heart, the lungs, the kidneys, and other organs, the brain, can be affected as well. It is a serious condition because it can be quite chronic, and it can manifest itself as just skin manifestations in the discoid lupus, or it can be the systemic form, which can affect the organs and can sometimes cause death. So it's a very significant condition. The first set of pictures we show you are the malar rash, which is a rash that occurs on the nose bridge and on the cheeks, and it spares the fold between the nose and the cheeks. And you can see it can vary from just some little plaques there to a raised red area or just a discoloration. And this is something that most Barbadians are highly sensitized to and look out for. A lot of people are concerned about having the rash and having lupus.
So it's called the butterfly rash generally.
Yes, because if it's confluent, it's confluent and affecting the nose bridge and the cheeks, it actually resembles a butterfly. But as I said, it can start out in a very patchy form before being confluent. It can be thick, it can be scaly, it can take many forms. And in addition to that, when you have the systemic form, you can have involvement of the other areas of the skin with lots of polycyclic plaques, which are oval plaques with dry edges. It can even resemble psoriasis, because in one of our earlier shows we did talk about papulosquamous eruptions, and this is one of the differentials for papulosquamous eruptions, and something that your doctor has to look at when that pattern emerges.
Wow.
How else does lupus manifest itself on the skin?
Well, it manifests itself in various ways. You saw there the butterfly rash, you saw the body rashes. You can also have the classical discoid lesion where, this is showing some alopecia, the diffuse alopecia on the left side of someone with systemic lupus. On the right, someone with discoid lupus in the early stage, just lots of hyperpigmentation, hair loss, the beginning of plugging of the hair follicles. But the discoid lupus later becomes a scarring type of hair loss and a scarring lesion where the center is very thin, and in addition to that, you get the plugging of the hair follicles. The outside gets very dark while the inside is very thin, and you can see all the blood vessels on the inside.
Wow.
So these are skin manifestations that can be very debilitating, and that's not something people want, because you can see the skin. But in addition to that, it can cause redness around the nail folds, something you call telangiectasia. You can also have vascular changes, which are red bumps or black areas on the peripheries as well. And lupus is something that we have to really look out for, and the diagnosis is based on some criteria from the American College of Rheumatologists. There are 11 criteria. It's rather a long thing, but once you have 4 of those criteria, then the diagnosis is highly suspicious.
And I want you to give us at least some of them.
Some of the criteria.
And we just want to let you know that some of the photos may seem a little graphic to you, but this is for your information.
Yes, definitely. Serositis, which is inflammation of the line of the organs, oral ulcers, arthritis, which involves 2 joints and our peripheral oral ulcers, and that's what that picture from the Indian journal shows you. Ulcers in the mouth that are quite painful. That's another skin manifestation. But other manifestations involve the blood, which is reduction in the red cells, white cells, and that sort of thing. The renal involvement is very important because that's the one that can actually cause death because it can present with proteins in the urine or blood in the urine. There are also immunological manifestations as well, and anti-nuclear antibody is a test that's done very often, and that test helps to tell you someone has an autoimmune condition. The malar rash, which is the butterfly rash that we saw before, the discoid lupus, and they can also be neurological manifestations. And these manifestations can result in someone having dementia or being depressed or even having seizures. This shows you a picture of a discoid lupus, which is a scarring lesion on the scalp, because discoid lupus occurs mostly on the sun-exposed areas. And so the scalp, the face, the earlobes, and the V of the neck, or if you are unlucky, it can be a disseminated form. A closer look at one of the discoid lesions showing you follicular plugging, and that lightening in the center, that is the scarring atrophy of the skin. Even though we don't know, another discoid lupus lesion, even though we don't know what causes discoid lupus or systemic lupus for that matter, the important thing is that your genetics may play a part, as well as the environment. The sunlight, you have to avoid the sun. Smoking isn't a good thing, and as with anything, stress isn't good either. But sometimes some medications can cause a discoid lupus-like reaction. So there are many things to consider. I guess the important thing is, if you are sensitized to the symptoms and you're worried about it, you should see your doctor. But it usually presents in a very vague way with fever or swelling of the lymph nodes, weight loss, or you're losing hair. And, you know, it's something that doctors can't really put their finger on at first, but it's there. Just trying to show you some of the other manifestations of discoid lupus, that plaque in the ear, another area exposed to the sun. But you can have it disseminated, so it can affect any part of the body. And this one on the right shows the soles of the foot in an unfortunate individual.
Dr. Andrew Forde, let me ask you about treatment, because you went through a whole series of things there that are very scary to the average person. Are these conditions treatable?
Yeah, certainly they're treatable. The important thing is to get an early diagnosis, and anyone who's trained in the West Indies has a high suspicion for lupus and tends to test for it very quickly. But the important thing is to stay away from aggravating factors. We mentioned the sun, we mentioned certain drugs that cause lupus and that sort of thing. But
the problem is that you don't always know. You get a rash like that, and you figure it's some little simple thing. Let me apply a little cream. Can we aggravate the situation if it is not diagnosed early?
Yeah, certainly. If you don't know you have systemic lupus and you go into the sun and you get a photosensitive reaction, that can trigger a whole reaction that brings on the sequelae and consequences of lupus. I mean, that sun exposure can cause a blistering rash. It can cause just redness. Sometimes it can even cause hives, which is something we talked about last week. But again, you need to get the diagnosis, and you avoid those things. For people with arthritis, the non-steroidal anti-inflammatories can be very useful, and they're these they really affect your immune system, things called corticosteroids, which can be used in the rub-on form. They can be injected, can also be used intravenously. There are other medications which are steroid-sparing, which assist the steroids, and there are newer medications that affect the immune system called biologics, and some other oral medications as well.
We'll pause for a cause here. We'll take a short break, and then we are willing to take your calls, 228-5562 or 63. Our dermatologist, Dr. Andrew Forde, is in. We'll be right back. 22 minutes after 6, that's our time here on Morning Barbados. Remember, your calls are welcome if you have questions regarding lupus or you have a question for our expert, our dermatologist this morning, Dr. Andrew Forde. We're continuing our focus on lupus, though. That is a condition that does extend to the skin. There are a lot of dynamics going on with this, and we will learn more about lupus as we go through. In fact, early next month, we will tell you what's happening with voices for lupus. But first of all, the butterfly rash, does everyone get this? Or is there a point in time, a point in the disease's process that it manifests?
Well, not everyone gets the butterfly rashes, especially if you're someone who just has a discoid form that's localized to the skin. You would more likely get discoid lupus. But there is a grade of severity from discoid to subacute to systemic lupus. And the butterfly rash is very common in individuals with systemic lupus. The important thing to know is that it doesn't necessarily have to be confluent or, just covering the whole area of the cheeks and the nose, but it can manifest itself as just a thickening or a dry area on the skin. And sometimes it can even look like psoriasis. But not everybody gets the butterfly rash. But if you have systemic lupus, those vague symptoms of hair loss and tiredness and joint pains and that sort of thing can give you an idea that it's going to come on.
All right.
Not every rash, though, is lupus.
No, and of course there are other things that affect the face. So patients can get very worried if they have something on the face. You can have rosacea. Lots of doctors sometimes get worried about certain types of eczema that affect the face and are concerned that it's lupus because of the high index of suspicion. There's also something called a polymorphic light eruption, where some people are just sensitive to the sun, and a polymorphic light eruption can manifest itself as just little bumps or red areas, or it can even manifest itself as blistering. So a lot of time, someone that has a polymorphic light eruption can be suspected of having lupus, but they just don't fulfill the criteria, and the tests, they just are lucky to just have a sun condition.
As in so often many cases where there is, I don't want to call it ignorance, when people just don't know, there are those who are concerned about catching lupus. Is there concern about the exposure of these, of the different types of skin conditions to other people in the home?
Well, certainly lupus isn't something that you can catch. You can have some genetic susceptibility, or if you have a history of autoimmune conditions, vitiligo, thyroid disease, or you have another relative who's had lupus, then there is a possibility. You should be more alert and aware of the possibility. But again, you need to have some of the symptoms or fulfill the criteria, and your doctor has to be concerned. If that's the case, you can do the test. But the important thing with having the systemic form, which is a more severe form, is that you monitor how the organs work. And the kidney is the important one, and your doctor will be monitoring that as you go along. And the treatments really are given based on how you do externally, as well as how your organ systems are doing if you have the systemic form. For the localized form that just affect the skin, like the discoid lupus, it's important then to try to prevent mutilation and to treat those lesions before the scarring starts, because scarring is for life really, unless you have some procedure done. And it's important to try to make people as happy as can be. The subacute form has some importance as well, because individuals with the subacute form of lupus, let's say a lady, because we didn't say lupus can affect men, it can affect women from 20 to 50. It can even affect children. And women with subacute lupus who deliver children, the children are at risk of having what's called a neonatal lupus, where they can have these oval or rashes on the skin, and having a condition of the heart called a heart block, which is permanent and requires some medical maintenance.
Dr. Forde, let me ask you, with all the advances in medical technology, is there some kind of test that would help determine someone's predisposition to lupus?
Well, I'm sure that will come on with time. We're always looking into genetics. That's a subject and an area that's rapidly increasing. But for now, the criteria that I mentioned to you are sufficient. And as I said, if you have a family history, then you should make yourself aware, read up about it, talk to your doctor about it. And if you think there's any thing happening to you that may suggest it, then you look into it. Because once you start early, it's something that can be controlled. I think some of the misunderstanding is the belief in the general public that if you have systemic lupus, you're going to die. And that's not really so. Lots of people with systemic lupus or the other forms that just affect the skin can live very productive lives.
And I know some of those people. And, you know, through Hope Foundation, it's an awareness group. That group has been around for many years, and they continue to do their good work. And we will continue to do our part to sensitize you here on Morning Barbados. But you mentioned basically then that it can be managed.
Yes.
So what would you say would be the biggest challenges about managing lupus?
Well, the biggest challenge with managing lupus is the external changes, especially if there's scarring in the discoid form. But of more importance is your organ systems and how they function. It can require a multidisciplinary approach, not only your dermatologist but your rheumatologist. And if you happen to have the neurological manifestations, then you may need to have a psychiatrist on board. So there's so many organ systems to be considered. But as I said, the kidney, the lungs, the heart, these are all very important areas. The blood vessels as well. People in colder countries can develop something called Raynaud's phenomenon, where when it gets too cold, their hands get very white, and then they turn blue, and then they turn red because there's a reactivity of the blood vessels, and that can sometimes cause a loss of the tissue in the digits, or even loss of a digit. And there's something called chilblains as well. There's so many manifestations. But the important thing is whatever your challenges are, your doctor will decide who has to come on in the management.
How early can it manifest, though? Because can babies be afflicted by
Yeah,
lupus?
we did mention the subacute form and the possibility of neonatal lupus, but the age group and the sexes, you know, male, female, anyone can have lupus, even though it's thought to be mainly a disease of young women between 20 and 50.
Given the chronic nature of the condition, how do you manage your life with lupus?
Well, I think one of the important things is to prevent those factors that you can control. And the sun, you can wear sunblocks, you can wear a hat, you can wear clothing which will cover your body but wouldn't keep you too hot. So light clothing that covers the body. Managing stress is important. Not smoking is very important too, because smoking can affect the blood vessels and how they react. But the important thing is when you see a new area on the skin coming up, you see your dermatologist, you get treatment early, and make sure that you don't get any scarring manifestations of lupus.
We know that you're not a GYN, but
Yeah.
how does this impact, if at all, on a woman who is diagnosed, you know, and she wants to have a baby? Is that still something that can happen? Does it impact that at all?
Well, it does, but not in a direct way. If you have had, or if you've been diagnosed and treated, or you've had the subacute lupus form, then you have certain considerations with your baby, as I mentioned before. But a family history is also something that you have to be vigilant. But these things don't usually preclude individuals from starting their family and just getting on with their lives and seeing what happens, because there isn't a direct transference. Because someone in your family has lupus, it doesn't mean that you're going to have it. And certainly it's something that can be picked up and can be managed. So the important thing is vigilance, but you can start your family and do what you have to do.
You talked about staying out of the sun, and you talked about covering your head and so on. Are there any particular types of medication that serve as irritants to the various skin conditions?
Yeah, certainly there's some common medications that can cause a lupus-type reaction. And minocycline, which is used to treat acne, is one of the main ones. But luckily, it's transient. Once you stop the medication, that goes away. Hydralazine, which is a drug used to treat hypertension, can cause it. And there's also an antifungal drug called griseofulvin that can cause it as well. So there are many medications that your doctor may give you for some other reason, and that can give you a lupus-like reaction. I think the good thing about that situation is that if you stop the medication, then your lupus-like reaction will go away. But it's important to let your doctor know the medications you're on. It all helps to make the diagnosis as to the cause and the type of lupus that you may have.
Okay, so tiredness, is that a direct result of it affecting your system the way it does, your joints? Why does lethargy happen?
Well, lethargy can be trace back to those blood tests that you do, because lupus can depress all the important blood in the body, the blood cells. So red cells, white cells, also platelets. But if you're anemic, that's a cause of fatigue. But also this multi-organ inflammation can also affect, and as I said, it can affect you in a neurological way. So that can be one of the causes of the fatigue. But a lot of autoimmune conditions do cause this vague fatigue, and that's why sometimes when you are just starting, you have these very subtle symptoms. It can be difficult for your doctor to really make the diagnosis because the symptoms seem so vague. Sometimes it seems as though some people are making it up. That's the problem that a lot of individuals with autoimmune conditions have initially, because sometimes the doctors feel that, you know, maybe it's stress and everything is psychosomatic.
Fibromyalgia.
Yes, fibromyalgia is another one of those that people get kind of brushed aside and not taken seriously. But the important thing is you have to know your body, and if there's a change and you think that you're not doing as well as before, you're tired, you can go to your doctor, have a general check, get some blood tests. You know, it's important. But in a very hot place like Barbados, where we have some serious sunlight and it's getting hotter every year, between 10 and 4, it's probably not a good time to be in the sun for anyone unless they absolutely have to. But if you need to be, then sunblock and protecting the skin and hats is very important generally, not only for lupus but for skin damage and for other things that we've talked about before.
And hydrate.
Yeah, definitely, definitely.
Better safe than sorry. Consult your physician.
Yes.
That's the only way.
And we're going to hear a lot more about lupus. We will actually have Shelley Weir of Hope Foundation on in the days ahead to discuss with us the work of the Hope Foundation. We'll tell you about Voices for Lupus and how you can get involved, what it means, and certainly help you understand what it's like living with lupus at various stages. You will get to meet some of the faces of lupus.
All right. Straight ahead on Morning Barbados, we're going to look back at the streetscapes of Bridgetown. Or perhaps we should just look today, because the more things change, the more they remain the same. The Monday edition of Morning Barbados comes back in a moment.